Hi, I'm Dr. Jason Winkleman, the founder of True Health Natural Pain Center here in Westminster, Colorado, where we help people end their chronic pain naturally and permanently. When I first started out in practice, the condition I witnessed being mistreated time and time again was chronic pain. I dissected the standard of care treatment options that were, and unfortunately still are being utilized today, and well, they all had to go. So, today I'm going to share with you why most chronic pain treatments fail and what actually works. The exact same principles that have made chronic pain sufferers flock to our clinic to put an end to their suffering and get their lives back. So, let's get started. Now, when I say conventional medicine, what I'm referring to is our most dominant model of medicine in this country. The one you're used to when you go to, say, the hospital or your primary care physician, that of MDs, DOs, physician assistants, and nurse practitioners. Practitioners of conventional medicine have a standard playbook. They make a diagnosis and then give the corresponding treatment, with that treatment being the standard of care. The standard of care is agreed upon by larger institutions such as the American Medical Association, the American College of Rheumatology, or the former American Pain Society, who, by the way, was forced to dissolve in 2019 due to allegations of colluding with opioid producers. These organizations, they essentially tell their member doctors how to treat different diagnoses, which sounds good, but only for a brief moment until you realize that you are now getting the exact same care as everyone else with your diagnosis, and that your doctors follow these protocols because they are just less likely to get sued if something goes wrong. There is little to no consideration for you, the suffering human being standing before them. This is the care you get: various over-the-counter pain relievers, followed by prescription drugs, mainly opioids, some generic physical therapy sprinkled in there before increasing your dose of those opioids, or trying injections such as steroids or nerve blocks, and ultimately surgery if there is an identifiable physical problem. Most of this is just trial and error, shot in the dark treatments. Let's throw everything at you and see what works. The focus is symptom management, and there is no attempt at finding and treating the root causes of your pain. No matter what your diagnosis is, how you initially got into pain, or how long you've been suffering, chronic pain is a physical, biochemical, and emotional problem. This is true for 100% of sufferers. And the only way to truly overcome it is by identifying the root causes on all three of these levels and treating them all at the same time. It takes a lot of skill, treatment options, and understanding of the human body to do this, which is why these pain management facilities exist, with their interdisciplinary team of specialists that will work on your care together, and so on and so forth. You've probably witnessed these places yourself. I've certainly been in them, and in my opinion, they're just a whole lot of talk. Sure, they have MDs and physical therapists and maybe even chiropractors, but despite sharing an office, they do not collaborate on your care like you think they do. They barely even talk to each other, to be honest. They all just stick in their lane and provide their standard of care. This interdisciplinary clinic model looks and sounds like holistic care, but it falls short. Pain management centers do just what they say. They manage your pain, they don't end it. There is an interconnectedness between your physical, biochemical, and emotional body, and you need a practitioner who understands that. But, doc, my chronic pain is from a disc herniation I suffered back in college when I was playing football. This is clearly just a physical problem. Okay, well, how about the fact that 64% of adults are walking around right now with some degree of disc herniation and they don't even know it because it doesn't cause them pain? Disc herniations are not always the pain generator. I mean, has anyone addressed your chronic inflammation or the fact that herniated discs tend to spill glutamate, an excitatory neurotransmitter that causes abnormal pain sensations? Okay, that's great, but I don't see what emotions have to do with this. In some cases, repressed emotions are the sole cause of someone's decades-long chronic pain. In all cases, though, they are a contributing factor. And I'll prove it with just this one question. Does your pain cause you fear? You have to ask yourself, are you afraid of certain movements, activities, or maybe weather changes? Are you afraid that if you overdo it today, you're going to be ruined for tomorrow? You have now activated an evolutionary defense mechanism to help you avoid pain. Your central nervous system is now on high alert to keep you from hurting yourself, even if there is nothing structurally wrong with you. Now, there are a lot of practitioners out there who understand this, that there are these three layers to chronic pain, but they don't know how to treat each of them themselves, and referring out to other practitioners puts us right back in the same fragmented care that you're used to. So, why don't the conventional routes work? Well, it goes back to symptom management. Conventional doctors are treating symptoms instead of you. Pain meds only put up a temporary block so that your brain doesn't process the pain. But whatever is causing it is still running a 24 operation. And the moment you stop taking that pain medicine or when it wears off, you feel the pain again. And what if the cause of your pain is not where you're feeling it? A hallmark of mold toxicity is vague symptoms and wandering pains. If we only look at your low back for low back pain, we will certainly miss a lot. Which brings me to limited testing. X-rays, CTs, MRIs, they're all valuable tools for telling us what your physical body looks like on the inside, but it says nothing about your biochemical or emotional ones. And when it comes to these factors, testing is a lot more limited than you realize. ESR and CRP, these are standards of inflammation testing, but they tell me nothing. And say these tests do come back and your inflammation is off the charts. Well, where is it coming from? Nobody bothers to test your gut health and food sensitivities. If you have mold toxicity or your hormones past the basics, there are root causes out there that have yet to be discovered, I promise you. And a final note, something we covered prior is fragmented care. The hallmark of a good doctor is knowing when they cannot treat something and to refer out. But now we have just created an even more discontinuity in your care because your neurologist and your gastroenterologist are not talking to each other, but you better believe that your gut and your brain are talking to each other. I certainly don't know everything there is to know about medicine and the human body, but most people suffering a chronic ailment fared better before we broke up our medical system into specialties. Now, I want to take a moment to set the scene here about the types of chronic pain that I'm seeing every single day. This is Holly. I began treating her in the summer of last year. She came to me with fibromyalgia that began about 46 years ago. She's 60 now, which means that her symptoms began when she was only in the eighth grade. She initially came to me with an 8 out of 10 pain every single day, and she would routinely have these stretches where she couldn't get out of bed for 3 days at a time due to the pain and fatigue. And she even used to be a nurse, but was forced to retire early because she couldn't perform at the levels that she needed to. And being a hospital employee, she had immediate access to whatever care she needed. Every specialist in the hospital was on her team, so she really had tried everything. Some things had helped decrease the pain, but really only for a short period of time and not without side effects that required more drugs to fix. When she came to me, she was taking Cymbalta, gabapentin, and hydrocodone, a very typical protocol for someone with fibromyalgia. Opioids, antidepressants, anticonvulsants to help with the nerve pain. She was also struggling with high blood pressure, high blood sugar, and was experiencing hair loss and thinning. She found me through a webinar I did, I think, with the US Pain Foundation about how mitochondrial dysfunction is an underlying cause of fibromyalgia. When I first met her, she was in tears because she felt as if 60 was just too young to die. Now, she didn't really think that she was going to die, but she knew that she wasn't living any sort of meaningful life. For the last decade, she's been watching everything just happen around her. She's missed all the big moments in her family's life. She can't travel to her family's mountain cabin anymore and just has to live vicariously through her husband's adventures. She's found it harder and harder to find enjoyment in things that she still can do too. And despite having had excellent medical attention her whole life and having seemingly tried everything for her pain, she still had hope that there was something that could help her. Now I want to introduce you to the holistic solution to treating chronic pain. I always say here at True Health Centers that we don't treat diagnoses, we treat people. And when you do this, you open up a world of possibilities like ending chronic pain, even when everyone else has told you that you're just going to have to live with it for the rest of your life. But this is a complicated process, which is why our fragmented healthcare system hasn't caught up yet. We thought we were advancing healthcare by creating a system full of specialists, but what we're actually learning is that we need to revert back into the older, tried and true system that addresses chronic issues like pain as a whole person problem. We have to create treatment plans that go beyond the standard of care and addresses people on an individual basis. A holistic approach to treating chronic pain means treating the whole person, not just their symptoms. Finding and treating all of the root causes of one's pain, again, physical, biochemical, and emotional. And this isn't a radical concept either. It's the most fundamental approach to medicine that we want to ignore because it doesn't involve a quick passive fix, taking a pill. All pain feels physical, which is why the medical community is quick to image the body part in question and recommend physical therapy. Whether or not there is a visible physical abnormality or not, we need to address your physical body because structure dictates function. If your joints are not moving freely, they will cause soft tissue contractions and allow inflammation to settle. Poor spinal posture not only leads to numerous pain conditions, but it can put stress on your nervous and hormonal systems. Poor posture can decrease serotonin and oxytocin while increasing cortisol. This is a cocktail for stress and inflammation. The function of your autonomic nervous system is impacted by spinal health as well. Not addressing your spinal health now makes it harder to treat the emotional and neurological contributors of your pain. But doc, I've already tried chiropractic. Okay, by itself, it's not going to do that much. I'm a chiropractor, and I'll be the first to tell you that chiropractic is not the end all be all that it can be touted as. A chiropractor is a necessary component of your healthcare team, but they are just one component. So if you're not doing everything else right, you're not going to see the benefits that you could be seeing. While adjustments aren't safe for everyone, I can tell you that chiropractic care is. There's a lot that we can do other than making your joints make a popping noise. Joint mobilization, soft tissue therapies, custom rehab programs, and custom orthotics are at the basis of proper physical medicine, something all chronic pain sufferers need if they want to get out of chronic pain. And a study showed that those who regularly see a chiropractor are 50% less likely to fill their opioid prescriptions. It's a powerful medicine when done right and combined with biochemical and emotional therapies. Treating your biochemical drivers begins with advanced lab testing so that we can properly diagnose everything that we can't see. You can't skip this step. All disease begins in the gut. Hippocrates said it, and it still stands the test of time. But how many of your chronic pain management doctors have ever addressed your gut health? Chronic inflammation, a hallmark of all chronic pain sufferers, begins in the gut. You cannot treat hormones without treating your gut health. Where do you think mold likes to reside outside of the respiratory system? What about those pain-relieving neurotransmitters? They're made in your gut. And for every cell in your body, there are 10 bacteria. So that means you are 10 times more bacteria than you are human. And they are largely found in your gut. So wouldn't you want them to be the good kind that aids in health? I know your pain feels physical, but you cannot ignore the biochemical drivers of your pain. They're there and they're plentiful. But there's not a pill or a surgery that can fix all of it. So we resort to the basics of human health to fix it. Are you living like a human is supposed to be living? Are you eating what humans evolved to eat? Are you avoiding the foods that cause you harm? And how's your sleep been? Or your hydration and relationships? And we typically don't think about these things too often because the human body is so resilient, but these are the things that make us human. If you didn't water your plants and give them sunlight, you wouldn't be surprised why they aren't staying alive. If you want to get out of chronic pain, you have to do everything right. But I know eating right is hard, and even if your diet is perfect, our soils are still depleted of nutrients. And that's why I'm right here with you. I've personally made a lot of dietary changes in my life, and I know how to do them right. So you have my guidance throughout your recovery. And when we do need to fill in the gaps, we have physician quality supplements to aid us. And I know you've already tried a lot of supplements before, but remember, we have to do everything right. Supplements by themselves can only do so much. And then that brings up the argument of quality and dosing. These are not the same supplements you can get off the shelf at your grocery store or a vitamin shop. A good chunk of these you actually need a medical license to get. The quality is vastly superior, the bioavailability is greater, and the dosing is a lot more effective. So now we've got a lot of good stuff going in, but we also need to get some stuff out of you, mainly environmental toxins like mold, heavy metals, and pollutants. Every day, new chemicals are being synthesized that we are being exposed to whether we know it or not. Your liver is an amazingly capable organ, but we aren't living in the same world your liver evolved in. So we are subjected to a greater quality and quantity of toxins today than we ever have. And if your liver can't keep up, pain, inflammation, and hormonal disruption are just the beginning. Now, by far the most overlooked component of a successful chronic pain treatment plan is your emotional health. Stress, anxiety, and depression, they're not isolated things. They can cause pain and they can be caused by pain, a vicious cycle that can only be broken with proper treatment. Stress, anxiety, and depression can alter your physiology, creating biochemical problems that lead to physical pain. But trying to stop this pain with physical or biochemical treatments is going to get you nowhere. But this is just the tip of the iceberg. Repressed emotions are one of the most detrimental things to our health that conventional medicine hasn't caught up to yet. And I might lose you on this one, but the research doesn't lie. When your body is not in perfect harmony, it creates signs and symptoms. Signs and symptoms do two things. They help expel pathogens and they help direct you to the source of the problem. Your body doesn't speak English, so this is how it tries to communicate with you. But what do? We suppress them. So you take ibuprofen for your pain, or cough medicine for your cough, or Benadryl for your itch, so on and so forth. But none of these symptoms were the problem. They're actually the solution, and you are now actively working against your body to get better. You're probably very used to symptom management as part of your pain management treatments, but as long as your doctor is treating your pain, they are missing the causes of your pain and actually making it harder to find them. So, what does this have to do with emotions? When something unpleasant happens in your life, we tend to want to forget about it, right? We take that memory and we stuff it deep down and try to forget about it. But guess what? Your brain doesn't forget about it. That memory, that emotion, it gets stored in your subconscious. And one day your brain does some spring cleaning and it wants it gone. But unlike your phone or your computer, you can't just delete this with the press of a button. No, the only way to get rid of repressed emotions is to deal with them. But we don't want to deal with them, so we stuff them back down. And the longer we do this, the angrier your brain gets. It wants you to deal with your problems, but because your brain can't speak to you in plain English, it creates signs and symptoms. And they usually start off vague and small. Maybe a cough because you have a habit of not speaking up for yourself. But then you'll probably just suppress that with some cough syrup. So your brain ups the ante, eventually causing you physical pain because pain is the one symptom most difficult to ignore. But the pain now feels physical, so you seek out a physical treatment for it. Are you seeing the pattern here? Your brain can create physical pain from your repressed emotions. It's a defense mechanism, it's trying to protect you, but it's also trying to get your attention. This is something talk therapy can facilitate, but it is best treated with proper mind-body counseling from your holistic chronic pain doctor. It's just a little bit different. And the last bit here is nervous system regulation, your autonomic nervous system in particular. This is the branch of your nervous system not under voluntary control. It does everything for you without you having to think about it. And it does a really good job of keeping you alive too. But when there are imbalances, pain and inflammation follow. This is a hallmark when it comes to treating things like fibromyalgia and migraines, problems of the circulatory system. Your heart and blood vessels can be completely healthy, but if your central nervous system is calling the shots, that blood won't get to where it needs to. And anytime you don't have blood, you don't have oxygen. And if you don't have oxygen, you have pain. There are only two solid ways to regulate your autonomic nervous system: breath work and a very powerful therapy called constitutional hydrotherapy. Neglecting your emotions and allowing your nervous system to be chronically imbalanced is a recipe for a life of chronic pain. So why this? Why does this work when everything else has failed you? And with all the advancements we have made in modern medicine, why is it that only 10% of sufferers ever get out of chronic pain with conventional medicine? Being a naturopathic doctor and a chiropractor, people think I'm against conventional medicine. I'm not. I'm glad they exist. I've had my fair share of ER visits to prove it. There's a time and a place for everything, and conventional medicine will save your life, but it will never make you healthy. It's not designed to. And that's okay. But all of us in the medical community need to understand our role and stay in our lane. Know when we can treat someone and when we cannot. Swallow our pride and refer out. Chronic pain is not a life-threatening condition. It will certainly take your life away from you, but it won't be your cause of death. Hopefully, it's clear to you by now why most chronic pain treatments fail. The reason I have been able to end people's fibromyalgia, migraines, arthritis, CRPS, low back pain, you name it, when nobody else has been, when conventional medicine has convinced them that they would have to live like this for the rest of their lives, is because I treated them and not their diagnosis. I found all of the root causes of their pain, physically, biochemically, and emotionally. And for the record, an overactive nerve is not the root cause of your pain. And then I treated all of these issues and at the same time with a comprehensive treatment plan that was individually tailored to each of them. There's no protocols, there's no standard of care, no drugs, injections, or surgeries. I did it using the medicine that humans evolved to survive and thrive on. But getting you out of pain isn't good enough for me. I need to make sure you know how to continue to treat yourself. Cut the cord of reliance on me and stay out of pain for the rest of your life. Education is the most important therapy I can ever give you. So, as you've now seen, there's a lot that goes into treating chronic pain: time, commitment, and expertise. And to provide you with the level of care you need, I utilize a program model, a 6-month, all inclusive, all natural, completely customized program that includes as many visits as you need. In order to treat the whole you, your doctor needs to get to know the whole you first. And this is going to take a lot longer than the 10 minutes of their time that your doctor has allotted you. Chronic pain is a lot more than where does it hurt? What does it feel like? And on a scale of 1 to 10, how bad is it? We've already established how complicated chronic pain is, so we need to dig deeper. You've got a life story to tell, and I want to hear it. I'm going to make you go all the way back to your childhood just to make sure we left no stone unturned. Your initial intake will take about 3 hours, so I mean it when I say I want to get to know the whole you. Now, after this, I normally have a pretty good idea of what's going on with you. But just to make sure that we, again, left no stone unturned, we run all those specialty lab testing, things I am confident you have not had before, or at least to this quality. Things like gut health and food sensitivity testing, hormone testing, organic acids testing. If we think that there's a mold toxicity or autoimmune component, we'll test for that too. It all plays a factor in your pain. Once we have all the data, then we can create a comprehensive treatment plan together that meets you where you're at and gets you out of pain. We incorporate naturopathic medicine to treat all the biochemical components. We'll make nutrition and lifestyle improvements together, and I'll provide you with those physician quality supplements to fill in the gaps. We incorporate chiropractic medicine like adjustments and mobilization, soft tissue work, custom orthotics, and an individualized rehab program to correct all the physical issues contributing to your pain. We'll continue this with constitutional hydrotherapies to balance your autonomic nervous system, infrared sauna treatments to help detoxify environmental toxins and reduce inflammation, and some cold laser therapy to boost your mitochondrial production and provide you with the energy that you need to heal. And then we'll incorporate mind-body counseling throughout to address how your central nervous system is contributing to your pain. This is all included, and you get as many visits as you need throughout the whole program. And of course, the best part, the education. Our conventional medical system has not only taught you that human health is a completely passive activity, take a drug for this and another one for that. It has made us completely reliant on doctors. Getting out of pain is one thing, but staying out of pain is another, and I don't want you to be reliant on me forever. In our time together, I'll teach you everything I know about pain and medicine so that you can keep treating yourself for the rest of your life. Now, there's something I've been keeping from you too. You do not need to be in Denver area to complete this program. It can be done virtually wherever you are. The lab test can be completed where you're at, supplements can be sent to you, and we can still do most of the treatments together. Where it looks a little different is the physical medicine. If your individualized rehab protocol requires things you can't do yourself, then I'll help you find trusted providers in your area and coordinate your care. Otherwise, my virtual patients get just as many visits as my in-person patients and get just as good results. So remember Holly from before? She come to me last year with fibromyalgia, 8 out of 10 pain every day. Well, this is her now. She's completed my 6-month program earlier this year, and we're both ecstatic to announce that she's living pain-free, 0 out of 10 pain every day. Now, she still wakes up about once a month, a little achy, she told me, especially after overdoing it the day before. But seriously, who doesn't? This is just normal human pains. And now here's the thing. There's nothing special about Holly. I mean, she's an exceptional human being, and I enjoyed treating her and her friendship over the last 6 months. But what I'm trying to say is she doesn't have any sort of genetic or non-genetic advantage that made her treatment so successful. We just got back to the basics, found all the physical, the biochemical, and the emotional root causes of her pain, treated all of her, and gave her the education she needed to be successful. We got her off all of her medications, and she only takes a few supplements every day for optimal health reasons. I just saw her a couple weeks ago, actually. She still comes in for regular adjustments, and she's still doing great. And it's not just her pain that is better, she has more energy. Her blood pressure and blood glucose have dropped to normal levels again, and her hair is even filling out. And not to mention, she went snowmobiling with her husband at the family cabin for the first time in years this winter. Just the thought of the cold, the altitude, and demand on her body would have sent her into a flare this time last year. She could work again, but why bother, she told me. She says she has so much life to catch up on now. She hasn't missed any of life's big moments and feels like her life is just beginning, really. See, that's the thing about holistic medicine in this program is we aren't just treating your pain, we're treating all of you, which means that you're going to leave a healthier person overall. Her only regret is that she didn't start sooner. So I want to leave you with this. You do not have to live with chronic pain any longer. You just need the right plan. So I invite you to schedule a free phone consult with me so that I can learn a little bit more about you, your needs, and just to make sure that we are a good fit for each other. You can do this either online at th.janeapp.com or by calling us directly at 970-716-0557. Seriously, thank you so much for watching. I am Dr. Jason Winkleman, and I really hope to meet you soon.